Hello world, my name is Dr. Kundlas and I'm a primary care physician for last 27 years. One question which comes over and over every day in medical practice is statins. Why should I take it? I don't want to take it. I'm having muscle pain. I'm having a liver problem. It's going to lead to diabetes. It's going to lead to memory loss. These days, in the beginning of the year, everybody is going through chronic disease management, and also a lot of people are getting their physicals. So this question is kind of a daily discussion. And I was talking to one of my patients yesterday, and he suggested that because I have to answer this question over and over, I must convert this thing into a video where I answer all these questions. Not only my own patient will get all the evidence-based answers, the general public will get any benefit. First question. Every year, statins prevent millions of heart attacks and strokes. And I truly believe if negative information and social media propaganda is removed, we can save millions of more lives and disability in future. Unfortunately, fear sells faster than the evidence, and that's exactly happens. First question. Every year, statins prevent millions of heart attacks and strokes. And I truly 100,000 patients, only one patient will get a real muscle injury or a disease which we call rhabdomyolysis, leading to discontinuation of medications. And only one patient out of 100,000 patients treated with statins will lead to liver problem requiring intervention or stopping of the medications. This is unfortunate that there is so much of negative information, and there is a lot of belief system which is so wrong. In this video, I intend to answer your question based on evidence. First of all, why do we need statins? If we are perfect citizens, we eat right, we exercise, we sleep well, we don't have vices, we will not be talking about statins. In the United States, the normal value of LDL cholesterol is about 30 points higher than the rest of the world. Prosperity has led to very rich food, which is leading to higher cholesterol, and when you combine with other vices of life and prosperity, we have this disaster. Statins are needed because we as Americans eat more than we should, we don't exercise, we smoke, we drink, and our sleeping pattern are not good, and we are always stressed out. We are a competitive society. So that is the need. So if we do not lower our cholesterol, either with a lifestyle or with medication, we will have millions and millions of patients who will get heart attack and stroke. As a nation, we spend $4.9 trillion every year on disease management. And majority of it goes to care of heart and stroke, bigger proportion. So that is the need. Why there is so much of negative information? Because fear sells fast, and fear goes to our core very quickly. Let's demyth muscle pains and statins. Statistics are 0.6 to 1.2 patients will get real muscle damage or rhabdomyolysis if you are on a statin therapy, in 1 in 100,000. Do you believe it is worth taking the risk? Whenever you see a little bit of aches and pains, that does not mean muscle damage. That is the time to discuss with your physicians. Statins are two kinds. One are water soluble and other are fat soluble. Fat soluble statins tend to give a little bit of more muscle pains. They are more effective, but they give you more muscle pain. Talk to your doctor. We will adjust your therapy, but do not stop medication. Statin therapy lowers your LDL cholesterol by 50 to 60%. If you're a perfect human being with a lifestyle, you could lower your cholesterol only by 15 to 20%. In many cases, if you're a diabetic, smoker, hypertensive, the amount of LDL cholesterol which needs to be lower so that you do not get heart attack and stroke is not enough. That's why, according to the new guidelines, if you're a diabetic, you're automatically put on cholesterol medication because we know we will prevent heart attack and stroke. Every 40 milligram per deciliter LDL cholesterol reduction leads to 20 to 25% reduction in future heart attack and stroke. So it is a real deal. Do not stop your medication. Statins do sometimes give muscle pains. As I alluded, that is rarely a reason to stop medication. Look for other reasons: dehydration, your physical activity, your sleep, your vitamin D deficiencies. All these things can lead to muscle pains. Talk to your doctor, they will figure it out, but do not stop the medication. Liver concerns and statins. Every time there is a mild elevation of liver test, that doesn't mean liver damage. Whenever you have an abnormal lab, talk to your doctor. They will adjust your medications. And remember, statins are not the only choice. Now, with the advent of the medication, you could lower your LDL cholesterol by 15 to 20% with lifestyle changes. Ezetimibe is another medication, PCSK9 other medication, and then older medication. We could use other medications in case you have a real problem or concern, but do not stop your medication. Only 1 in 100,000 is the chance of you getting a real liver problem. I was asked a question, why primary care and cardiologists are pushing for cholesterol medication so much. Changing habits and changing lifestyle for good is very, very rare. It is proven fact if 100 people have been given recommendation to change their lifestyle, only 2% achieve it long term. We want to protect you and we want to stick to the evidence. If you take cholesterol medication, you will lower your risk of developing future heart attack and stroke. Mechanistically, if you are on statin, there will be one increased or extra patient who will possibly develop diabetes out of 1,000. But we save millions of lives. And if you are a diabetic, you must be on statin therapy to prevent heart attack and stroke. That is the only medication which predictably works, and we know that we could lower your risk. As a medical community and patients, your other risk factors like smoking, diabetes, blood pressure, they are hard to control and the statistics are very poor. But one place where it works effectively and predictably is statins. Statins and memory loss. There is no evidence till today that the statins increase risk of dementia or memory loss. There was few studies initially which were touted. They all have been debunked in randomized controlled trials, and none of them has ever shown to lead to any kind of long-term effects. What are the alternatives to statins? That is the other question I've been asked over and over. As I said, lifestyle is always number one. Number two, azitamides. Number three, older cholesterol-lowering medications. And if everything fails, now we have biologics. They are PCSK9 class. They can lower your cholesterol. Do not leave yourself unprotected. I do not believe majority of us will not be able to tolerate. I truly believe all of us can tolerate statins, but if for some reason you cannot or you won't, there are other alternatives. And that is the message I want to make sure. In this video, I want to clarify that statins prevent future heart attack and strokes. If, God forbid, you already have a stent, bypass, stroke, or PAD, it has more benefit in preventing future heart attack and stroke and keeping you alive and preventing death. They are safe. They do not lead to any memory loss. There will be one extra case of diabetes if 1,000 patients are being treated with statin. Help us make you live long and happy. As a physician, it's very painful to see few of you end up getting heart attack, stroke, and crippled because we could have talked, we could have understood each other better, and you could have taken the medication. I want to make sure you understand if you have multiple risk factors, diabetes, blood pressure, smoking, other social vices, cholesterol lowering is the most predictable. Within 2 to 3 days, the medication will block the pathways and you will have your cholesterol lowered. I hope that you understand the facts better than before. Like, share, and subscribe to my channel, Kundlas MD, and we will continue to produce more informative videos. Please share your comments. I understand this will polarize few people, but I want to know you and I want to provide you evidence-based information. Thank you. Love you all. See you in next video.